Okay, we're going to talk about cancer, and I know that word alone can be pretty heavy, but what if I told you this is actually one of the most incredible success stories in all of modern medicine? Let's dive into how a once fatal diagnosis became a true model for a cure. So first things first, who does this affect? Well, here's the kicker. Testicular cancer is the #1 solid tumor found in men between the ages of 20 and 40. We're talking about guys in college, starting their careers, building families. It hits right in the prime of life. But, and this is a huge but, despite being the most common in that age group, this is not a story of despair. It's actually a story of incredible progress and overwhelming hope. In fact, it's become the gold standard, the very paradigm for how to successfully treat cancer. So let's get right into that transformation. And look, this isn't just a slight improvement. We're talking about a turnaround so dramatic, it literally changed the field of oncology. Just look at the numbers here. They're staggering. Before the 1970s, if you had advanced disease, your chance of survival was less than 10%. It was practically a death sentence. Then, a chemotherapy drug called cisplatin came along and completely rewrote the rules. Today, long-term survival for that exact same advanced disease is somewhere between 80 and 90%. That's not just progress, that's a revolution. So, how in the world did this happen? Well, to get it, we have to talk about something called germ cell tumors, or GCTs. Over 95% of all testicular cancers start in these specific cells, the very cells that are supposed to become sperm. And that unique origin story is the key to everything. It explains how the cancer behaves, and fascinatingly, why it's so incredibly vulnerable to treatment. But here's the thing. Not all germ cell tumors are the same. Right off the bat, doctors make this crucial distinction, splitting them into two main camps. And believe me, which camp a tumor falls into determines the entire game plan. Okay, so on one side, you've got seminomas. Think of these as generally slower growing, a little less aggressive. They're often caught earlier, and they are just exquisitely sensitive to radiation therapy. Then on the other side, you've got the non-seminomas. These are the more aggressive cousins. They're made up of a bunch of different subtypes, and they usually demand a real 1-2 punch of both chemotherapy and surgery to get that cure. Yeah, a non-seminoma isn't just one thing. It's more like a cocktail of different aggressive cell types, and each one has its own personality. But there's one ingredient in this mix that is particularly weird and really changes the whole game, something called a teratoma. The word teratoma literally means monster tumor, and it is bizarre. It can form mature tissues like cartilage, hair, or even teeth. But here's the most important part clinically. It is completely 100% resistant to chemotherapy. Chemo can wipe out all the other cancer cells, but the teratoma just sits there unfazed. And that's exactly why surgery is non-negotiable. That monster has to be physically cut out. All right, let's switch gears and get practical, because understanding the risks and, most importantly, the warning signs is the absolute first step in taking advantage of this incredible curability. You know, there are a few really well-established risk factors. Having an undescended testicle, even if you had surgery to fix it as a kid, that increases your risk. A personal or family history matters a lot, too. Interestingly, having a brother with it is an even stronger risk factor than having a father with it. And for reasons we don't fully get yet, it's way more common in white men than in Black or Asian men. Now, if you remember just one thing from this entire explainer, please let it be this. The #1 most common sign is a lump or a mass that does not hurt. The very fact that it's painless is what's so dangerous, because it makes it so easy to ignore. Any solid mass found in a testicle needs to be checked out, period. Now, while that painless lump is the classic sign, it's not the only one. Some guys do experience sudden pain or swelling, or maybe just a feeling of heaviness or a dull ache. And in more advanced cases, the first clue might be something totally different, like a persistent backache from tumors in the abdomen, or even a noticeable lump in the neck. So what happens when a lump is actually found? Well, the great news is that there's a very clear, very methodical, and very fast playbook that doctors follow to get a definitive answer. The whole diagnostic journey is remarkably straightforward. It all starts with a simple physical exam. If the doctor feels a mass, the very next step is a quick, painless scrotal ultrasound to confirm if it's solid and if it's really inside the testicle. At the same time, you'll get blood tests to look for these protein clues called tumor markers. And all of this leads to the final step, a procedure that, believe it or not, both confirms the diagnosis and starts the treatment. And this brings us to the absolute guiding principle for doctors. In a young man, any solid mass found inside the testicle is treated as cancer until a pathologist looks at it under a microscope and proves that it's not. There's no let's wait and see. The approach is always, always swift and definitive. So, what about those blood tests? Well, doctors are hunting for 3 specific proteins that basically act like little flares being shot up by the tumor. Some markers are only made by certain tumor types, so that helps with the diagnosis. But what's really crucial is that doctors track how fast these markers drop after surgery. If they don't fall as quickly as they're supposed to, it's a huge red flag that some cancer might still be hiding somewhere in the body. The final, definitive diagnostic step is the surgery itself, a radical inguinal orchiectomy. Now, this isn't just taking a little piece for a biopsy. The entire testicle is removed through a small incision in the groin, not on the scrotum. And that's super important to prevent any cancer cells from spreading. For localized disease, this one operation is often the total cure. And, of course, it provides the tumor for the final, definitive analysis. Okay, so once the cancer is diagnosed and staged, a whole team of experts gets to work. And the goal is simple: to tailor the treatment perfectly to the exact type and stage of the cancer, to get the absolute best chance of a cure while causing the fewest side effects. For advanced non-seminomas, doctors don't just guess how much chemo is needed. They use a very precise risk classification system, and as you can see, the vast majority of guys, even with advanced disease, fall into a good or intermediate prognosis group. This system is so important because it lets oncologists perfectly dial in the intensity of the chemotherapy, giving just enough to guarantee a cure without causing any unnecessary toxicity. The modern toolkit for fighting testicular cancer is just incredibly powerful and refined. For very early stage disease, the best option might actually be active surveillance, basically just watching it closely. For others, it could mean a major surgery to remove lymph nodes, called an RPL&D, and of course you have the cornerstone of cisplatin-based chemotherapy, and for seminomas, radiation. It's all about picking the right tools for the right job. And the result of using all these tools so effectively? An overall cure rate of over 95%. Just let that sink in for a moment. Across all patients, all stages, from the absolute earliest to the most advanced, this is one of the most curable solid cancers that exists. It's a true testament to decades of scientific research. This quote from the medical literature really says it all. Germ cell tumors have become the model, the absolute gold standard for how you cure a solid tumor. It's the perfect showcase of how combining smart surgery, powerful chemotherapy, and a deep understanding of the biology can turn a deadly disease into one that is not only manageable, but ultimately curable. This victory was no accident. It was built on 2 essential pillars: a massive scientific breakthrough like cisplatin, and public awareness that encourages early diagnosis. Which leads us with a really powerful and hopeful question. What will it take to make this success story the story for every cancer?